Hi everyone. In this video, we will talk about nurse practitioner salaries in Canada in 2021. I will preface by saying that you should never choose to be an NP or a nurse if your intention is to make money. There are many more careers out there that make way more and require a lot less work. The point of this video is to educate people so that they can make a decision that is best for them. In this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a video every week. Also, be sure to give this video a thumbs up if you found it useful, as it helps others see the video as well. Nurse practitioners are providers that have autonomy depending on which province and which country you work in. In the States, there are areas where NPs can work autonomously and do not require physician presence. In Canada, however, NPs work in collaboration with MDs, but they do not have full autonomy just yet. However, this is an ongoing discussion in the political world, and there are clinics, although few of them, that have only NPs. I personally have chosen to be an NP, and I believe it is a great career choice for many nurses who are aspiring to increase their scope of practice to better help others. Check out the description box down below if you're interested in finding links to any of the topics discussed here. So before talking about salary, let's talk about the education journey for becoming an NP. NPs have a Bachelor's of Science in Nursing, which typically takes 4 years of undergraduate studies to complete. Then they must pass the NCLEX exam. After that, they must work as an RN for approximately 1 to 2 years. Then they can apply to different nurse practitioner programs. The requirements may be a little different depending on the school, but that is generally the application requirements. Now, after you get into NP school, your training is anywhere from 2 to 4 years, but once fully trained as an NP, you can choose to work in various different settings, which will impact the pay you receive. As a nurse, you're paid from a wage grade in Canada. However, as an NP, you're not. Instead, you're paid based on a salary from the institution you choose to work at. As a result, the salary you get can vary depending on the practice area that you choose to focus on. However, here are some of the salaries that I have found on the internet doing some research. The link from where this data is derived from will be in the description box down below. In Canada, overall, nurse practitioners make $87,000 to $101,000. In BC, you can make $94,000 to $165,000. Alberta, $85,000 to $106,000. Saskatchewan, $95,000 to $113,000. Manitoba, $89,000 to $107,000. And Ontario, anywhere between $98,000 to $115,000. Now I will go into the site-specific areas where NPs work in order to give a better idea how much these NPs make in that specific job setting. As mentioned, NPs' salary will vary depending on where they work. The first area I'm going to talk about is the primary care clinic. These numbers are based in British Columbia, as that is the province where I reside. So primary care clinics, you can expect an income of $120,000 to $145,000, and the shifts are usually 8 hours. The duties of these nurse practitioners are the comprehensive assessment of patients or clients or residents, including diagnosing diseases, disorders, and conditions, initiation of treatments including healthcare management, therapeutic interventions, and medication prescriptions. They practice somewhat autonomously and interdependently within the context of an interdisciplinary healthcare team, making referrals to specialists physicians and others as appropriate. Telemedicine. Telemedicine platforms enable patients to speak with medical professionals and receive prescriptions online and get prescriptions delivered to them directly every month. You can expect an income of $62,000 to $91,000 a year, and they have to be available for 5 to 20 hours per week. The responsibilities will be reviewing patient intake forms, speaking with the patient over telemedicine video call platform, issuing prescriptions if appropriate for non-controlled substances, emailing prescriptions to different pharmacies. Hospital/clinic within a hospital. Shift type is usually 8 hours. Income is $73,000 to $110,000, and the role of the NP in that setting is accountable for comprehensive assessment of patients and clients, including diagnoses, diagnosing diseases, disorders, and conditions, initiating treatments including healthcare management, therapeutic interventions, and prescribing medication according to the guidelines and limits. They provide professional guidance to other healthcare professionals and participate autonomously as a member of the interdisciplinary healthcare team. They collaborate with clients and other healthcare professionals to identify and assess trends and patterns that have implications for clients, families, and communities. They develop and implement population and evidence-based strategies to improve health and participate in policymaking and quality improvement activities that influence health services and practices. They participate in peer program and self-review to evaluate the outcome of the services at the client, community, and population level. They're responsible for own professional development and maintaining competence in the position and maintaining privileges as active medical staff as they're required by the province's rules and regulation. They report to an operational director, professional practice, and have key accountabilities for quality assurance and patient safety within the regional department of nurse practitioners. So there you have it. Those are nurse practitioner salaries in Canada and some various work sites where they work. I hope this video was helpful. If it was, I would greatly appreciate it if you give the video a thumbs up. Thank you so much for watching this video, and I will catch you in the next one.